Now, Utah is always at the forefront when it comes to medicine, and there's a new specialty, believe it or not, right here in our state. I want to bring in Dr. Catherine Hayes. She is with the University of Utah Health and Intermountain Primary Children's Hospital. Welcome to the show, Dr. Hayes. How are you?
Good. Thank you so much for having me.
Good. Now, you are a pediatric gynecologist. Let's talk about that because I think a lot of people, even me, myself included, had no idea that that was a thing.
Yeah, so I take care of people from birth until age 18 for any reproductive healthcare needs.
Wow. So, I mean, it's something that I think is starting to happen at a younger age for a lot of women. So it's probably, or girls, I should say. So it probably is something that's needed because you probably have to treat a younger girl differently than an adult woman.
Yeah, so I like to think that kids aren't just little adults. And so the way that we care for them is a little bit different than how we care for adult women. So, for instance, with teenagers or younger girls who are having, say, period problems, they may not respond to the hormonal medicines in the same way as an adult would. And so it takes some extra training and finesse to get the right combination for these patients.
How interesting. I mean, I've never thought about it, but it makes complete sense when I hear you say it. Now, as far as how unique this is that we have it compared to around the country, how many other people are doing this?
Yeah, there are very few programs. There are about 11 academic programs that include fellowships where pediatric and adolescent gynecologists train to become our specialist. However, there's a few other hospitals that have some pediatric gynecologists, but it's pretty uncommon here in the United States.
Now, I think that first visit for a young woman is always kind of intimidating and scary. So, for the parent that might be watching right now that's trying to talk to their daughter and say, hey, maybe you need this, or maybe she's watching, what would you say to that?
Yeah, so we are really kind and caring and compassionate here in pediatric and adolescent gynecology, and we really take the time and focus on you and your needs. And so it's all about the pace that you need us to go at. And so if you're a little bit uncomfortable, we'll talk you through everything, kind of let you know what to expect and what's going to happen. And my most important thing is that it's your body and you're in charge of it. And so if something's uncomfortable, I want you to let me know and we can stop.
I like it. Dr. Hayes, what age would be too young to bring someone to you, or is there a limit?
There's no limit. So I see babies who are born with congenital anomalies or differences of the reproductive system or other systems in their body, as well as toddlers and preschoolers who are maybe having some vaginal discharge or some itching in the vaginal region, and then older kids for precocious puberty or puberty that's happening too early, and then teenagers with bleeding complaints.
Good to know. Well, if they want more information, where can they go?
You can go to our website, primarychildrens.org, for more information about our services.
Great. Well, Dr. Hayes, thank you so much. And pretty neat to have this in Utah.
Thank you so much for having me.